Hello everyone, welcome back once again to this channel, Pharm Academy. We are still continuing with the GIT or gastrointestinal tract disorders. The other thing that that's classified under the disorders is what we call diarrhea. So we want to look at how can we manage diarrhea, and most people, these are some of the common presentations that you may get in the community, that you may find that you are going to encounter with. So you need to know how can you manage it, and how can it be handled. So we see that the term diarrhea is derived from the Greek word. As we can see, we see that diarrhea denotes increased fluidity of the stool, meaning increased fluids in the stool, and yet they are supposed to be reabsorbed at the colon. And we see that more frequent motions might have also caused this. And we shall see there is abnormal frequent passage of loose stool, or abnormal passage of stool with increased frequency. We see also that diarrhea is roughly defined as the greater than 250 grams daily stool production, containing roughly 70% to 95% water concentration. So you see that your patient may perceive an increase of fluid or water in the feces or stool fluidity, and then the frequency, like if they always get once maybe a day, you may find that they have 2 times or 3 times a day. You can also there is also low volume, or we can have painful diarrhea, and that one is what we call dysentery, and sometimes we have bloody diarrhea that we call dysentery. Okay. So what are some of the signs and symptoms of diarrhea? You find that there is loose or liquid stool. Your patient will present with that. You can also have bloody or mucoid. You can also have that presentation. There can be dehydration. There can be cramping, abdominal pain. There can be also fever. There can be loss of appetite. And then we shall have painful distended abdomen can also be there. Others, you may have a frequency, duration of the diarrhea, bloody or not, and consistency. These are some of the things that you need to ask when a patient comes saying that they're having loose stool. You ask them if it is mucoid, you ask them whether it's bloody, you ask them whether they are having abdominal pain, whether they are having fever, whether they are not having appetite, and then you can examine the stomach, whether it's distended or the abdomen. Actually, the right word is abdomen. You examine the abdomen. How do we classify diarrhea? So we can classify diarrhea based on the duration. If it has not taken a longer time, we can say that's acute type of diarrhea, and we see that it presents in 3 or more loose watery stool within the 24 or the first 24 hours. And we can also have what we call chronic diarrhea, whereby it will last for more than 2 weeks, and it is associated with the recurring passage of this loose stool. So some of the causes that may bring diarrhea, we can see can be as a result of infection, post-infection, or it can be as a result of drugs. When we just looked at the different drugs that are used to manage the gastroesophageal reflux and peptic ulcer disease, we saw that some of the drug side effects was diarrhea, and to be more specific, that was magnesium hydroxide and magnesium trisilicate. Yeah. So that's what we need to know: the causes, the duration, how do you classify them. So briefly that. So some of the drug-induced diarrhea, we see that laxatives can given always to patients that are having constipation or that present with constipation. So when you're giving laxatives to your patient and they are using it for a long time, your patient can experience what we call diarrhea, whereby we shall have a mechanism of action of laxatives. We see that they are osmotically active solids, and the excess of fluids and electrolytes are not reabsorbed back in the system, and they get mixed up, and the person will end up having this diarrhea. Erythromycin can be another cause. We can have increased motility, bring about diarrhea. Antimicrobials, those are different medications that are used to manage microorganisms. Then we have antineoplastics as another cause, and then alpha glucosides inhibitors can also be a problem. Then we have lipase inhibitors as another problem. So what's the mechanism of diarrhea? How does it come about? So we see that osmotic diarrhea is a retention of water in the bowel as a result of an accumulation of non-absorbable water-soluble compounds that ceases with fasting or discontinue oral agents. Okay, so we see that your diarrhea may come as a result of failure to reabsorb the water back into the large intestine, and when that happens, your patient will present with diarrhea. Secretory diarrhea is when we have active intestinal secretion of fluids and electrolytes. You find that instead of them being reabsorbed or absorbed at the large intestine, instead we are getting them excreted. We get a number of fluids getting excreted at that specific area of the gastrointestinal tract. So we can experience that. And this can be caused as a result of maybe colonization of parasites, colonization of bacteria, and destruction of the mucosal lining. So you find that it can bring about these specific types of or mechanisms of diarrhea. We also have what we call inflammatory diarrhea. That's the damage to the intestinal mucosal cells, leading to a loss of fluid and blood. So you can have that. There can be pain, there can be fever, there can be bleeding, inflammatory manifestation can also be there. We can also have abnormal motility area, whereby there are changes in motility at that specific area. So when that happens, we shall have what we call malabsorption. We can also have what we call combination of maybe all these other things that we have talked about. So for you to manage your patient, you may need a combination therapy, or you may need more than one medication. So one of the drugs that you may need to use, we have rehydration salts. When we look at the cause, the signs and symptoms, we said there was dehydration. So since there is dehydration, we may need to use rehydration salts in managing your patient. Then we also have opioids. We have adsorbents. Okay, you may need the adsorbents, those that are going to absorb the excess water that is being secreted probably at the colon. The colon is part of the gastrointestinal tract. Then you may also need the spermiolytics or spermiolytics is another medication that you would use for management of this specific condition. So how do the oral dehydration salts, or how are they used? So we see that the priority in acute diarrhea, as in the gastroenteritis. When there is inflammation at that specific area, we call it enteritis. So oral rehydration salt is used for oral replacement of electrolytes that have been lost, that have been secreted from the body. In a patient with dehydration associated with diarrhea, when your patient is dehydrated as a result of diarrhea, you give the oral rehydration salt. So the components of the oral rehydration salt, we have anhydrous dextrose, we have sodium chloride, we have the potassium chloride, and we can also have the trisodium citrate. Some of the side effects that your patient may encounter while using this specific medication, your patient may present with a mild nausea, like urge to vomit, and some may even vomit. Okay, so these effects can be decreased by taking this product slowly in small amounts with a spoon. That's why when you have made 1 liter of this specific oral rehydration salt, you make sure that the person doesn't take it all at once at the same time. You make sure that your patient takes it in bits. We are looking at another class of drugs that we may use when we are managing this diarrhea. We also have what we call adsorbents and bulk forming drugs. So these ones clog the walls of the gastrointestinal tract, and you find that they bind to the causative bacteria or toxins, which is then eliminated through the stool. Some of the examples of these adsorbents, we have the bismuth, and then we have activated charcoal is another one, and then we have kaolin pectin as another one. Some of the side effects that may arise, we have increased bleeding time, we have constipation, we have dark stool, and then there may be confusion, stretching, hearing loss, and patient may experience a metallic taste. Anti-motility drugs, those drugs that affect or that come in to help us manage motility. Because if there is increased motility at the colon, there will be less absorption or absorption of these electrolytes and fluids, and as a result we'll have diarrhea. So examples of the anti-motility drugs that we have morphine, and then we have codeine. We also have loperamide as an anti-motility drug. We see that loperamide is mostly used, and most people have abused it, and they even end up giving it to children. So let's appreciate today that loperamide, if a patient is presenting with diarrhea and that patient is less than 12 years, it's not recommended for it. So we see that we use this loperamide for its specific symptomatic relief to acute diarrhea. Loperamide is an opioid receptor agonist and acts on the alpha opioid receptors in the mesenteric plexus and the large intestine. Loperamide works like morphine by decreasing the activity of the mesenteric membrane, which decreases the tone of longitudinal and circular smooth muscles of the intestinal walls. Undergoes fast pass effect in the liver, it is pharmacodynamics, and does not cross the blood-brain barrier. This can be a marking point that you need to always remember. Some of the side effects that loperamide may cause, we see that it may bring abdominal cramps, it may bring dizziness, it may bring drowsiness, and skin reactions. For example, urticaria. Urticaria is an inflammatory skin pathological condition that your patient may present with. Anti-spermiolytic or spermiolytic agents. So we see that these drugs in this specific section may include the antimuscarinic compounds and drugs believed to be direct reluctant of the intestinal smooth muscles. So those smooth muscle reluctant properties of the antimuscarinic agents and other anti-spermiotic agents may be useful when you are managing what we call irritable bowel disease. The presentation that irritable bowel disease will give to your patient is diarrhea. So when you suspect it's as a result of this irritable bowel disease, you give this specific medication to them. So these anti-muscarinic agents that you give, we can have atropine, we can have hyoscine, then hyoscyamine. What is their side effect? The side effect that we expect or that we may suspect, we have what we call urinary retention. The patient may present with headache, the patient will present with dizziness, confusion, anxiety, drowsiness, dry skin, rash, flushing, blurred vision, and photophobia. Other classes of the antispasmodic drugs, you may have the varinines. You can have the drotavarine, you can have the mebevarin, and then the alvarin. You see that these are direct reluctants of the intestinal smooth muscles, and by doing so, it will enable reabsorption of these separate ions by inhibiting those ions, and once they are inhibited, sodium ions are opened. So some of the side effects that the patient may encounter when they are using, you may still have abdominal cramps, and this medication is majorly used when managing irritable bowel disease. Motility stimulants, we are looking at how to improve the motility of the GIT. You may use metoclopramide and then domperidone, some of the dopamine receptor antagonists, which stimulate the gastric emptying and small intestine transit and enhance the strength of esophageal sphincter contraction. So kindly look out for the non-pharmacological management of diarrhea, and what do you think is the role of antibiotics in management of diarrhea? Maybe briefly on antibiotics, we see that some of the infection or diarrhea can be as a result of the invasion of the different bacteria. An example of the bacteria that may invade and bring about diarrhea, we can have E. coli, we can have Shigella, can bring about diarrhea. So when you have taken stool analysis and you have identified the bacteria and you are sure, you recommend antibacterials. You can recommend, for example, metronidazole is a nucleic acid synthesis inhibitor that you can use for managing this specific diarrhea. Yeah, so you can use it as combined therapy with these other classes that we have looked at. You need to appreciate that. And in case you have any questions, kindly put them in the comment section, because we have come to the end of diarrhea. The next class that we come back, we are going to look at something new that may be constipation. So we know that the opposite of diarrhea is constipation. So when we look at it hand in hand, we are able to appreciate and we are able to grasp and know how to manage our patients when they present with this specific condition. Subscribe to Grapharm Academy. Kindly stay tuned, share these videos to your friends, your classmates, your workmates. You need to always update information every time, because knowledge is not toxic and we never stop learning. So let's learn. And in case you have any questions, kindly put them in the comment section and I will be in position to reach out to you and answer all questions that you'll be having. Thank you.